Have you ever wondered how a condition like epilepsy, often misunderstood, has affected some of the greatest minds in history, like Vincent van Gogh and Julius Caesar? Epilepsy, a word that often brings to mind dramatic images of convulsions and loss of consciousness, is much more than that. It's a chronic disorder, a neurological enigma characterized by recurrent, unprovoked seizures. It's not just an isolated condition, but a widespread phenomenon that touches every corner of the globe. It's estimated that epilepsy affects approximately 50 million people worldwide, making it one of the most common neurological diseases globally. This means that chances are you know someone or will meet someone with this condition. It's not a condition confined to any one group of people. It crosses all ages, races, and social classes. So it's clear that epilepsy is a widespread condition. But what actually causes these unexpected seizures? Let's dive deeper. One might think that epilepsy is a result of a single cause. However, it's a bit more complicated than that. Just like a puzzle with multiple pieces, the causes of epilepsy are varied and multifaceted. Genetics play a significant role in many cases. Some people are born with a predisposition to the disorder due to mutations in their DNA, but it's not always about the genes. Head trauma, such as injuries from car accidents or falls, can also lead to the development of epilepsy. Then there are brain-related conditions like strokes or tumors, which can trigger seizures by disrupting the normal functioning of the brain. Infectious diseases such as meningitis can also cause epilepsy, as they involve inflammation of the brain. Moreover, prenatal injuries, resulting from malnutrition or oxygen deficiencies during pregnancy, can cause brain damage that leads to epilepsy. And yet, despite all these potential causes, for some people the root cause of their epilepsy remains a mystery. As we see, the causes are numerous and sometimes elusive. But how does one recognize an epileptic seizure? What are its symptoms? Not all seizures look the same, and recognizing the signs of an epileptic seizure is crucial for effective response and treatment. Epileptic seizures can manifest in a number of ways, and awareness of these symptoms can be a life-saving knowledge. One common sign is a sudden bout of temporary confusion, where the person may seem lost or disorientated. This could also present as a staring spell, where the individual appears to be gazing into space, seemingly unaware of their surroundings. In some cases, seizures may involve uncontrollable jerking movements of the arms and legs. This can be quite alarming to witness, but it's important to remember that the person is not in control of these movements. Loss of consciousness or awareness is another telltale sign. The person may suddenly black out or seem detached from their environment. Lastly, psychic symptoms such as fear or anxiety may also precede a seizure. These symptoms can be frightening, but thankfully there are treatments available that can help manage epilepsy. While there is currently no cure for epilepsy, there are several treatment options that can help manage the symptoms and improve quality of life. Let's delve into the most common treatment plans. Medication is often the first line of defense, with a wide range of anti-epileptic drugs available to help control seizures. However, it's important to remember that what works for one person might not work for another. When medication isn't enough, surgery might be considered. This can involve removing the area of the brain where seizures originate or severing the connections between the affected parts of the brain. Another therapeutic option is vagus nerve stimulation, where a device is implanted under the skin to send electrical signals to the brain to reduce seizure frequency. Dietary therapies, such as the ketogenic diet, have also shown promise in controlling seizures, especially in children. Remember, each individual is unique, and so should be their treatment plan. Epilepsy might be a complex condition, but with understanding and appropriate treatment, it can be managed effectively. So, in these few minutes, we've uncovered the enigma of epilepsy, a condition that affects millions globally. We've explored its definition as a neurological disorder characterized by recurrent seizures. We've delved into its various causes, from genetic factors to brain injuries. We've highlighted its recognizable symptoms like loss of consciousness and uncontrolled movements, and we've navigated the treatment landscape, discussing medication, surgery, and lifestyle adjustments. Remember, knowledge is the first step in understanding and managing conditions like epilepsy. Stay informed, stay healthy.